Licensure by endorsement and mutual agreement. Now, this is where one state grants licensure based on the applicant having had a license in good standing in another state for a certain length of time. Some states allow providers from another state to provide telehealth services in their state if they share a common border. That's what I was talking to you about. The term cross-state counseling started. Some states are adding an exception to state licensure for healthcare providers in specific situations to help preserve continuity of care. We'll talk about some of those. For example, a state may allow care to continue through telehealth if there's a pre-existing patient-provider relationship and the provider has performed an in-person exam of the patient within the previous 12 months. Now, when COVID happened, that was the case in a lot of situations. Most states wouldn't allow you to do counseling in their state unless you had a prior in-person relationship, even for telebehavioral health. They wouldn't let you see anybody unless you had that established. But as the time went on, that had to change, or people wouldn't be getting their needs met. And it has changed. And lots of laws have changed in the last couple of years, too, to back it up. License portability means working state by state to make moving from one state to another easier by removing barriers to portability where they exist. That's going to be great when that happens. And there are a lot of different states that are working on that, and a lot of different organizations like the Counseling Association and the Psychology Association is already taking care of it. Counseling Association is pretty much almost ready, and social workers as well. And then some of the others like the medical field and others. Marriage and family and some other professions do not belong to compacts yet. Therefore, portability might mean obtaining a license in each state of practice. This remains a problem as it does not offer easy portability. And it makes it difficult because then people have to, when somebody moves or goes on vacation or they need to go live with their parents for a month or two for emergency reasons or whatever, then our clients are left with the problem of finding somebody else to meet their needs, when it would be so much easier if they could just stay with the counselor that they trust and the person that they know is helping them and working with them on their treatment plan, and not start all over with somebody else. So portability remains really important for so many reasons. But the Psychology Interjurisdictional Compact has been going along for quite a while, and it's been really helpful if you're a psychologist out there. The Psych Pack is a multi-state licensing compact allowing a psychologist licensed in a state that has joined Psych Pack to provide telepsychological services or temporary in-person services to patients in other Psych Pack states. Psych Pack is an interstate compact designed to facilitate the practice of telepsychology and the temporary in-person face-to-face practice of psychology across state boundaries. The commission's also responsible for granting psychologists the authority to practice telepsychology and temporary in-person face-to-face practice of psychology across state borders. It's a mouthful. So there's some other terms that go along with the Psych Pack. Authority to practice interjurisdictional telepsychology. This legally permits a licensed psychologist the authority to practice telepsychology within the limits authorized under the compact in another compact state. So both states have to be a member. Authority to practice interjurisdictional telepsychology is deemed valid until the psychologist is no longer eligible under the compact statute and or the rules and or the policies established by the commission. The psychologist first must obtain an e-passport certificate. So if you're a new psychologist, this will be important information. Temporary authorization to practice. This to temporarily in-person, face-to-face within the limits authorized under this compact in another compact state. This temporary authorization to practice is deemed valid until the psychologist is no longer eligible under the compact statute and the rules or policies established by the commission. And then the e-passport, which I mentioned here, the psychologist must obtain one of these. A certificate issued by the Association of State and Provincial Psychology Boards that promotes the standardization and the criteria of interjurisdictional telepsychology practice and facilitates the process for licensed psychologists to provide telepsychological services across state lines. That's what an e-passport certificate is. Interjurisdictional practice certificate is a certificate issued by the Association of State and Provincial Psychology Boards that grants temporary authority to practice based on notification to the State Psychology Regulatory Authority of intention to practice temporarily and verification of your qualifications for that practice. So there is the possibility of seeing people temporarily in other states as a psychologist. Now, the receiving state is a compact state where the client or the patient is physically located when the services are delivered. That's the receiving state, and even the remote state. Temporary in-person face-to-face, defined as when a psychologist is physically present, not using telecommunications technologies in a distant state, remote state, to provide for the practice of psychology for 30 days within a calendar year and based on notification to the distant site. So if your client goes away on vacation for 2 weeks to California, it's possible you could get a temporary authorization to see your client. So they're also working on the compact for social workers. A social worker wishes to use the compact to practice in other states will apply for a multi-state license. To be eligible, a social worker must be eligible for or hold a license in their primary state of residence, which must be a member of the compact, and meet other eligibility criteria. So as you can see, your profession has to be a member. They have to have a compact, and then your state has to be a member of that compact, and then the state where your clients are located needs to be a member of that compact. 3 things. Because social work licenses are issued at the state and provincial level, social workers need to apply to practice legally in a new jurisdiction, whether they're practicing in person or electronic social work services are provided. This is where I got that information. The social work license or compact allows bachelor's, master's, and clinical social workers in member states to apply for an interstate compact license that provides a multi-state authorization to practice in all compact member states. I think that's wonderful. I'm so happy that that's happening right now. This allows a social worker to care for clients located in any compact member state without having to go through each member state's licensure process. Isn't that wonderful? To be eligible, social workers must reside in a compact member state and maintain an active unencumbered license. Unencumbered means a license is not revoked, suspended, or made probationary or conditional by the licensing or registering authority in the respective jurisdiction because of disciplinary action. So no issues with your license, and then you live in a compact state, and then you can apply. Good news all around. So for counselors, the counseling compact is an interstate compact or a contract among states allowing professional counselors licensed and residing in a compact member state to practice in other compact member states without need for multiple licenses, similar to the social workers compact. 30 states have enacted the Counseling Compact, and applications for Counseling Compact privileges to practice are expected to open in 2024. All about 2024. And this is where I got the information. So you can go to the counselingcompact.org, and you can do the same for social workers. And eblaw.com has a lot of insight over this. There are some differences in state laws that you need to know about in order to see someone in a different state. If you're going to see someone in a different state, you still have to follow the laws of that state and your state. So we're mandated reporters. So obviously we're going to need to know about mandated reporting. We also have to know about informed consent laws and duty to warn laws because they're different in all states. Different licensing laws, different terminology used with different meanings. Even telehealth has a different meaning. So when you look at a law in another state, you'll need to look at the definition for telehealth, telebehavioral health, Telemental health, they all use different terms, different practice requirements, and different liability insurance laws. That would make it different too. So those are some things to consider before you see someone in another state.